May 2026, the Atlantic Ocean. The cruise ship MV Hondius is drifting in open water, and no port will let it dock. On board, 147 people from 23 countries. 3 are already dead. 9 are infected with a deadly virus for which there is no vaccine and no cure. The authorities of Cape Verde refuse to let the ship ashore. The world is watching this dot in the ocean and asking one question: how did this even happen? Before we talk about the ship, let's figure out exactly what we're dealing with. Hantavirus is not a new virus. It has been known to science since 1993, when it first broke out on a Native American reservation in the southwestern United States. 13 people died within a few weeks, young, healthy individuals. Nobody understood what was happening at first. The virus doesn't spread from person to person, it spreads from rodents. Mice and rats shed it through their urine, feces, and saliva. A person gets infected by inhaling dust contaminated with their droppings. One breath in an infected space and the virus is already in your lungs. Symptoms appear 1 to 8 weeks later. First comes high fever, abdominal pain, and body aches. Then a sudden and severe decline. The lungs fill with fluid. The person starts to suffocate. Without intensive care and mechanical ventilation, death follows. The fatality rate is up to 40%. That's 20 times higher than COVID-19. But there's one important nuance. Almost all strains of hantavirus do not spread from person to person. Almost all, except one, the Andes virus, the only strain with documented human-to-human transmission. And that is exactly the strain on board the MV Hondius.
Let's reconstruct the timeline of events. April 1st, 2026, the port of Ushuaia at the very southern tip of Argentina. 86 passengers and 61 crew members board the ship. Ahead lies the expedition voyage of a lifetime: Antarctica, the South Georgia Islands, Tristan da Cunha, St. Helena. The first few weeks go exactly as planned. Icebergs, penguins, seals. Passengers go ashore on islands, walk around, take photos. April 11th, the first person falls ill. High fever, abdominal pain. The ship's doctor assumes it's a common infection. Treated symptomatically. Late April, the condition of several passengers deteriorates sharply. One is evacuated by helicopter to a hospital in South Africa. There, intensive care. There, death. May 2nd. The WHO receives notification. May 6th. Laboratory analysis confirms it. Andes virus. Hantavirus with possible human-to-human transmission. By May 8th, 9 infected, 3 dead. The ship is anchored off the coast of Cape Verde. No one will let it into port. 147 people are stranded in the open ocean. The situation turned into an international crisis within days. The WHO gets directly involved. Negotiations with Spain, and the ship sets course for the Canary Islands. Tenerife agrees to receive the vessel, but only for medical evacuation. The critically ill are taken off on stretchers. Ambulances race to hospitals. A plane carrying patients flies to Amsterdam, to the Radboud University Medical Centre, one of the leading centres for infectious diseases in Europe. The remaining passengers disembark under medical supervision. Everyone has their temperature taken. Swabs are collected from all. Those who had contact with the sick into quarantine. But here's the problem. Some passengers had already left the ship early, before the quarantine was imposed. People from 23 countries had already flown home. The CDC and WHO begin tracking more than 200 contacts around the world. In parallel, an investigation on board. Specialists examine the cargo hold. for rodents, set traps, take surface samples. While scientists were working, the internet was already on fire. The hashtag HANTAVIRUS racked up millions of mentions overnight. Masks were swept off pharmacy shelves. People wrote, "This is it, the start of a new pandemic." Comparisons to COVID flooded social media. Some influencers were already drawing graphs of exponential growth. But let's look at the facts. COVID-19 has a transmission rate R0 of 2 to 5. That means one infected person spreads the virus to an average of 2 to 5 others. That's exactly why it swept across the entire world within months. Hantavirus, even the Andes strain, has an R0 below 1. One infected person spreads it to less than one other person on average. The virus stops itself. To catch the Andes virus from another person, you need extremely close and prolonged contact, the kind involved in caring for a seriously ill patient without protective gear. Simply being in the same shopping mall, not enough. The ECDC officially stated, the risk to the European population is very low. The WHO confirmed, this is not the beginning of a pandemic. The panic was understandable, but it was unnecessary. The main question that still has no definitive answer, how did hantavirus end up on the ship? Theory 1, and the most likely, the islands on the ship's route. Tristan da Cunha in particular, the most remote inhabited island on Earth. Field mice live there that can carry hantavirus. Passengers walked around the island, sat on the grass, breathed in the dust. One breath near infected droppings, that's all it takes. Theory 2. A rat boarded the ship back in the port of Ushuaia. Port rats are a reality on any cargo or cruise vessel. A rat lives in the hold, contaminates food or the air in the ventilation system. Theory 3. Human-to-human transmission. The first infected person spread the virus to others in the enclosed space of the ship. The WHO did not rule out this theory, which is exactly why a maximum isolation protocol was implemented. Samples from the cargo hold have been sent for analysis. The virus's genome is being sequenced to determine exactly where it came from. Results are expected in the coming weeks. The good news, protecting yourself from hantavirus isn't complicated. You just need to understand how it spreads. First, never clean up mouse droppings with bare hands and without a mask. A country house after winter, an old warehouse, an attic. These are classic high-risk zones. Put on gloves and a respirator, open the windows, air the space out, and only then start cleaning. Second, in nature, don't touch mouse burrows. Don't sit in areas where you can see rodent traces. Don't leave food uncovered in a tent or a car. Third, if you're traveling in South America, Argentina, Chile, Brazil, these are elevated risk zones. Avoid abandoned buildings and caves. Pack gloves. Fourth, watch for symptoms. Fever above 38 degrees, abdominal or lower back pain, shortness of breath. Especially if you've recently been in contact with rodents or visited a risk area. Go to a doctor immediately, don't wait. With hantavirus, every hour determines the outcome. There is no vaccine yet, but several candidate drugs are already in clinical trials. Here's where things stand today. MV Hondius, a cruise ship that set off on an exotic voyage and became the epicenter of an outbreak of one of the deadliest viruses on the planet. 3 dead, 9 infected, 200 contacts around the world under monitoring. The WHO and ECDC say there is no pandemic threat. The risk to the global population is low. The system worked. The virus was identified quickly. Patients were evacuated. Contacts are being tracked. But this case is an important warning signal. The world has become too small. A cruise ship in 6 weeks visited Antarctica, islands lost in the middle of the ocean, and nearly reached Europe. A virus living in field mice on an uninhabited island, ended up in intensive care units in Amsterdam and Tenerife within weeks. The COVID pandemic changed how the world responds to outbreaks. Today, the WHO, CDC and ECDC work in sync. That is progress. But the investigation is not yet complete. The incubation period for the last known contacts doesn't expire until June. New cases are still possible. Stay informed and write in the comments. Were you following this story? Were you scared? Or did you immediately realize the panic was overblown? Subscribe to the channel. The next video is coming soon.